Hello friends, I am going to discuss about the thoracic radiography of a Labrador dog presented with the history of coughing and respiratory distress. You could see here, so this is the lateral radiograph of a thorax. So for normal radiographic anatomy, so these are the different thoracic vertebrae. This is the sternum. This one is the first pair of the rib. So it makes the thoracic inlet, and this is the diaphragm. If you see the diaphragmatic line, so this diaphragmatic line is clear. So here this is the one cross of the diaphragm, this is the second cross of the diaphragm. So here in the dorsal region, so both crosses they crossing at the level of vena cava. So it means this particular radiograph has been taken in the left lateral recumbent view. So the important point here, which we see the mid portion of the thorax, so we'll find that the margin of the heart is not clear, particularly cranial margin of the heart, whereas the caudal margin of the heart is visible. If you see the trachea, so trachea is almost okay. Otherwise, if you make a hair, so trachea is normally located at the 15-degree angle to this vertebral. This is normal, no problem. But here you will find, so there is a loss of the cardiac salute in this particular region here. So if you see, so this is the primary bronchus, and this primary bronchus, you could see here as if it is a branch of some tree. So this particular type of radiographic sign we notice in case of the pulmonary edema. So what happened? So this all the alveoli of this right cranial lungs lobe, they filled with the fluid. So that's why there is no air here. Only the air present in the bronchioles and the bronchi that are only visible, and because of that it appears as it is a branch of a tree. So this particular type of radiographic feature we name it as a ear bronchogram. So you could see this is the ear bronchogram. So this is the classical radiographic sign of the pulmonary edema. It means fluid in the alveoli of the lungs. And when it's filled, so what happened? It marks the edge of this heart. Means the cranial margin of the heart is obscured by the artery, masked by this particular lungs lobe, which is filled with the fluid. So this one is the region for the coughing and the respiratory distress. And if you look at this caudal lungs lobe, so it is clear, there is no such type of finding here. Overall, the trachea is normal, vertebrae is normal, this one is sternum is normal, diaphragm is okay. Even the heart size appears to be normal. So this is the problem in this cranial lungs lobe, particularly the right cranial lungs lobe. So this is the pulmonary edema of this particular lobe.